What's up, guys, and welcome to episode 58 of the unofficial NCLEX podcast. This episode is titled Implement Emergency Response Plans. In a previous episode, I talked about how the plan can differ. The plan for a emergency response of a nurse on the coast of Florida working in the neuro ICU versus a disaster emergency plan for a nurse in the middle of nowhere, Wyoming, working as a school nurse is going to look very different, So we're not going to go into very, very specific, but you need to be able to identify that this is really important to implement emergency response plans, and nurses play a very significant role in emergency response. So one of the things that nurses frequently need to do is utilize a color coding system to triage patients as they are identified that they need care. So this can look different in different areas, but just as an example, let's say red patients are color coded with maybe a sticker or something that's put on their gown or their clothes to quickly communicate to others, hey, what are we doing? Excuse me. Which patients are the priority? So maybe red would significant, this patient has life-threatening yet survivable injuries. Maybe yellow would indicate a medium priority patient. Injuries are severe, but they're not life-threatening. And maybe green would communicate low priority. They can wait an extended time and they have non-life-threatening injuries. And occasionally they'll use black, where the patient is either deceased on arrival or actively dying, signaling, hey, this patient is passing, and us utilizing time and resources to prevent that from occurring are futile at this point. So nurses working with physicians may go through and triage patients so that the other care staff knows what to do quickly, and they're not wasting their time reassessing patients when they could just hop right in and get to care. It's also important with emergency response plans, regardless of where you work in the country and regardless of what specific kind of nurse you are, that you have an internal and an external plan. This is what I do as a nurse at work, and this if a disaster or emergency occurs, and this is what I do if I am a registered nurse and I am at home. This is what I do. So those things can look very different, right? Do you have a phone tree? Okay, these are the first nurses to respond because they live the closest, and then these are the backups, and then this is where you sleep, where you would stay at the hospital. I work in the most frequent one I see is when we have inclement weather and we have maybe a snowstorm or something where it's not safe to be on the roads, and nurses are sleeping at hospitals for days at a time because it's not safe for them to drive home and back each night, but they need to be at work to provide care. Nursing is very different than a lot of other fields. Many other fields, while their job might be very vital, it's not vital to the absolute survival of people that they have to go into work when a disaster occurs. But nursing is different. Civil service is different. If you're working as a police officer, firefighter, or whatnot, you have a similar requirement. So that's part of living the nurse life and being a registered nurse, that we have these kind of expectations if a disaster or an emergency occurs. So that is important for you to know, that what to do if you're at home and what to do when you're at work. And if you don't know, where do I look to find out this information? It's very, very important to do and know as a provider or a bedside nurse. So that concludes episode 58, Implement Emergency Response Plans.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at NRSNG.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.